The Medicare wellness visit is an annual clinic visit that is uh, covered by Medicare. And if you are part of a Medicare Advantage plan, chances are you'll also receive some sort of financial compensation. But again, you can only do it once a year. Uh, this clinic visit is about prevention, planning, and staying ahead of problems. It's not the same as a full annual physical exam, so it's very important to note. Um, what you should expect when you go for this visit, and usually more time is allotted for this wellness visit than a typical clinic visit, from what I understand. And basically, um, what they do, they take certain measurements, weight. They also ask about your family history, your health history, and your medication list, including supplements you might be taking. And you should be fully aware that it's up to you as the patient to provide this information, things about your health history, but your family history, medication list. So the patient is pretty much obligated to have all this information organized and presented. The goal with this visit, like I say, it's not a full physical exam, but rather it's a way of coming up with a prevention plan. And it's not merely check your vitals and send you home. What you have to realize is that you cannot bring up new complaints or ask for a new diagnosis for a new condition. Even you cannot bring up any kind of management issues that you have with your chronic disease. This wellness visit is well known in popular culture by draw the clock. Now, this is part of the memory check, and it is a informal cognitive screen. In fact, it's referred to as a mini cog. And what it is that as you're being interviewed, usually by a nurse, he or she will give you three words, and with the expectation that sometime later in the interview, you're going to have to recite these three words. And it's a way of, I guess, screening for some sort of short term memory impairment. Now, three words is not too difficult to manage. In fact, if I recall correctly, a couple of years ago, they had used five words, which is a little bit more difficult. So it's certainly easier now. Now, as far as the draw the clock exercise is concerned, you're given a piece of paper and a pencil, and you're asked to draw a clock face with all the associated numbers representing hours. And then you're given a time to represent on the clock face. And typically it's something like illustrate the time 12:10. And then the patient has to correctly draw the hour hand, which is shorter, obviously, pointing to the numeral 12, and then the longer hand, the minute hand, pointing to the numeral 2. It seems very simple, but like I say, it's in an effort to screen for more serious cognitive issue or deficit. And what can happen sometimes, as explained to me by uh, one of the doctors I spoke with, is that sometimes completely ignore one half of the clock face. This is referred to either as hemianopsia or hemi-neglect. So essentially what they're drawing is just one half of the clock face, either with just the numbers 12 to 6 or 12 to 12 all on one side. And they might not be aware of this deficit, but it certainly merits further investigation if this shows up in this simple screening test. Now, besides the mini cog, there is also um, included in the interview questions about your mood, if you're feeling depressed, your functioning, how you're coping with activities of daily living. I believe it's called ADL. And it's also to talk about safety matters, whether you have problems ambulating, um, exercising, walking, whether you've had any instances of falling, which is certainly very important to discuss and to plan for in preventing in the future. And the whole point of this is about preserving independence where you can feel more able to live on your own, perhaps live at home for a longer period of time. And if not, if there are problems arising with this, then a plan could be initiated to address some of the issues with things like ambulation or preparing food or laundry, et cetera, et cetera. Now, the thing is, the comment that I want to make about this practice is that the patient is obligated to prepare for this. Prepare, like I said, medication lists and supplements, family history, and any other helpful records. Now, when I was in medical school, typical intake for a patient consisted of what they call the HPI, the history of present illness, where the clinician would do a rundown of all these aspects of a person's health, which includes um, the drug use, the sexual activity, family history, social circumstance. But it seems in these days of limited time available for clinic visits, the doctor is only obligated to address issues that the patient brings up, which I consider a major change from the traditional practice of medicine. And again, it's all about saving time. So this leads to the project that I'm currently working on, which is AI-empowered healthcare. It's a book I'm working on, and it shows patients how to use artificial intelligence to help manage their health records and produce reports. And this wellness visit is an ideal circumstance to have a report that you prepared using AI and presenting it with all the necessary information that is requested in this clinic examination. Certainly, there are limitations to using AI for self-diagnosis and care management, and the patient must be aware of these limitations. And the patient must be aware that whatever they discover using AI, they cannot begin to institute it as a management plan unless a doctor is involved with the decision making. Obviously, if you're going to choose to start taking certain over-the-counter drugs or supplements, you're free to do this, but it's not a good idea, and it's important for the doctor to be aware of this, and you should seek his or her comments on the appropriate use of these medications or supplements, considering your clinical picture. So I strongly advise patients to take that route, where not to change their behavior or take new meds unless they get some sort of consultation from a doctor. As with all of my videos, I'm going to be providing a quote I think I found interesting or beneficial, and it comes from Ernest Hemingway, who in 1954 won the Nobel Prize in fiction. And this was based, well, when he was awarded this prize, what was cited, his work of literature cited, was The Old Man and the Sea. And it has a strong a lesson that people, older people like myself, can find as some sort of inspiration. And the quote goes, again, it's by the character Santiago, who is the main character. And he says, now is no time to think of what you do not have. Think of what you can do with what there is. This requires self-reflection, and certainly a lot of the material I'm presenting on these videos has to do with self-reflection about optimizing your approach to life, taking a very active role in managing your life with an idea of creating a legacy, of living a meaningful life. So I think this quotation is very apropos. So I'd like to end this video just by saying, if you find this information helpful, please subscribe and stay tuned for future videos which will expand upon these topics.